one other questionnaire that we asked families and caregivers to fill out as part of the study 1, 1504, and the open label extension is this global clinical impression of change. It's a pretty simple scale. It's a 1 to 7 Likert scale where families are asked to say, is your child improved, much improved, or very much improved, or worse, slightly worse, or very much worse. And this is an attempt to get at sort of just a global picture of how the child is doing, which certainly is going to take into account seizure frequency, but it also is going to take into account maybe how well the drug is tolerated and maybe some of these other non-seizure endpoints that we've already discussed. And so we actually did a secondary analysis of the patients from study 1 and went back and looked at what percent of patients actually gave their a score of very much improved or much improved, so 1 or 2 on the clinical global impression of change. And we just a priori defined that as being clinically meaningful. So then we went back and tried to anchor that to what degree of seizure reduction is necessary to actually achieve that score of 1 or 2, and did a receiver operating characteristic curve and showed that 44% was kind of the magic number. So you needed to have a seizure reduction of 44% or greater in order to have a high likelihood of giving that score of 1 or 2. So that was nice because it kind of reinforces the whole 50% reduction in seizures as being a clinically meaningful endpoint. And so then when we put that line on our responder curve, 75% of the patients who received the 0.8 milligram per kilogram dose, so 75% of the patients actually achieved 44% seizure reduction or greater. So another way of saying that would be 75% had a clinically meaningful change in seizure reduction.